Arizona hospitals are prepared, and you don't have to take it from just me. You can take it from Arizona hospitals, including Banner Health, Dignity Health, Honor Health, Abrazo, Carondelet, and Northern Arizona Healthcare. There's been a lot of misinformation out there. It's important that we have the facts straight on where we are in hospital capacity in Arizona, because our citizens deserve to have the facts. Recently, there have been local and national media reports regarding the increase in confirmed positive COVID-19 cases in Arizona and how our state is managing the COVID-19 crisis. As representatives of the largest health systems representing 80% of care provided in the state, we'd like to assure the public that we have the available bed capacity and surge plans are in place to continue to serve the people of Arizona. We are well prepared to manage an increase in patient volume. It's important that people know we are not seeing an increase in patient volume. We are prepared if that increase should come. The facts are we've got an increase in testing, an increase in cases, and an increase in positive test results. So we're going to continue to stay laser focused on COVID-19 in the state of Arizona. The plan going forward is we're going to continue to focus on public health and the education campaign around it. Physical distancing, washing your hands, staying home if you're sick, and wearing a cloth face covering when you cannot physically distance. We'll continue to increase testing in the state of Arizona, which will give us more sightline to what our situation is at the state level. We'll have a constant focus on cases and hospital capacity. We've got a team of 44 experienced epidemiologists tracking the data in real time, the number of cases, and measuring the hospitalization rates with continued surveillance, and load balancing of our hospital resources. And we're going to prioritize where the risk is highest in Arizona. It's our skilled nursing facilities, our long-term care, and our prisons. We're 100% focused on the proper decisions for the state of Arizona, and we're going to continue to make those decisions. The fact that I'm demonstrating of what 3+ months of work to have available hospital capacity, to be focused if there were to be a worst case scenario. And the fact that that worst case scenario is not here today is positive news. So we're going to stay focused on this. We want people to make responsible decisions like they have so far, and we're going to be able to navigate through this. I think it's important that people have the facts. This virus is not going away. There's not a cure for this virus, and there's not a vaccine for this virus. So this virus is something we need to learn to live with, and we need to make sure that we are protecting the most vulnerable in our society, and those are folks at a certain age bracket with underlying health conditions and at-risk conditions, and we're going to continue to do that every single day until there is a vaccine.
So let me follow up. I'm reading from Dr. Chris' blog here. Wear the cloth face mask in public regardless of whether you feel sick or not. That way you're protecting yourself, your family, and others in the event you're infected and don't have any symptoms. When was the last time you wore a face mask, Governor?
I was in, well, first I want to say I'm all for face masks when you can't physically distance. I've got my my face masks with me today, and when I'm not physically distancing, I wear them and wash them often. Cowie, can I answer the question, please?
Sure.
I mean, I've listened to your question. Can I give you an answer? Okay. Even on the CDC guidance, it says it can be difficult to physically distance in places like pharmacies or grocery stores. I was in Walgreens picking up some things on the way home, and I've been to the grocery store. In both places, I wore a face mask, and face masks are good. So if you can't physically distance, wear the mask. My message is to Arizonans is to stay vigilant on this. We need to stay focused on making sure that our citizens are safe and that we continue to navigate through COVID-19. The things Dr. Christ pointed out about when you can't social distance, first and foremost, social distance, but the face covering, washing your hands, staying home when sick. Let's redouble our efforts on that. I think part of it is, one, Arizonans have been terrific, as good as any people in the country in navigating through this so far. But it is human nature. People want to get back to life, and I understand that. I want that as well, but I want as many people to be healthy. I want to avoid as much sickness as possible and certainly save as many lives and care for the people that are sick. So that would be the message in closing, is that Arizona has hospital capacity, but let's refocus our efforts on washing our hands, social distancing, covering our face when we can't social distance. And if you're sick, please stay home. And if you've got the opportunity this weekend, and especially if you've been out and about quite a bit, go and get a test. That information, that data will help us and inform decisions going into the future. Thank you, everyone.